Sometimes, a man climaxes too quickly during intercourse. This disorder is called premature ejaculation. But what are the causes? And what can we do so that the sexual act doesn't last too long? Let's find out together with today's video. Hello and welcome back to Med for Care. Today's topic is premature ejaculation. Ejaculation is defined premature when it occurs during sexual activity within about a minute after penetration, and in any case before the individual wishes it. It is a rather widespread phenomenon that can significantly compromise individual relationships. The World Health Organization defines premature ejaculation as the inability to delay ejaculation, manifesting either as an event of ejaculation before or very soon after initiation of intercourse, or occurring in the absence of an erection sufficient to make intercourse possible. According to the most recent estimates, premature ejaculation is the most common sexual disorder in the male population, with an incidence between 20% and 30%. But we know why does ejaculation happen too soon? The causes of premature ejaculation can be complex and can vary from person to person. They can be divided into physical and psychological causes. Among the physical causes we have problems such as low testosterone levels, an alteration of serotonin levels, increased hormone levels of LH, prolactin and TSH, specific diseases such as chronic prostatitis, inflammation of the urethra or Peyronie's disease, taking antidepressants or blood pressure medications. However, the inability to control ejaculation seems to be linked more to reasons of a psychological nature. Performance anxiety. That can cause premature ejaculation. Relationship problems. An unsatisfying relationship or communication problems with your partner can contribute to premature ejaculation. Past trauma. A history of sexual abuse or emotional trauma can cause sexual problems, including premature ejaculation. Mental health issues. Depression, anxiety, can cause premature ejaculation. In some cases, the cause of premature ejaculation can be a combination of both psychological and physical factors. The problem affects the physiological reflex of ejaculation, which consists in the expulsion of sperm at the end of sexual intercourse. Let's see in more detail how the mechanism works. The phenomenon of ejaculation is controlled by the spinal ejaculatory generator, which receives information from the sympathetic and parasympathetic nerves of the penis and communicates with sensory and motor nerves. This process sees the collaboration of central and peripheral nervous system. The first phase is called emission, which consists in the introduction of seminal fluid from the seminal vesicles to the prostate and to the posterior urethra. Then we have expulsion, when seminal fluid travels from the posterior urethra to the urethral meatus. This phase is possible through the contraction of the pelvic floor muscles. Finally, we have orgasm, which is a brain process associated with physical events, such as contractions of the accessory sexual organs. Well, we have looked into the causes of premature ejaculation in detail. Now let's move on to the diagnosis. Single sporadic episodes of premature ejaculation need not be a concern at all. If, on the other hand, the phenomenon is recurrent and such as to cause significant discomfort, then it is necessary to go to the specialist doctor for an andrological or sexological examination. During the visit, it is essential that the doctor collects an accurate clinical history. The doctor may ask the patient to describe his symptoms and to quantify the time between the onset of sexual arousal and ejaculation. No laboratory or instrumental tests are necessary, but if this disorder is associated with erectile dysfunction and loss of libido, testosterone and prolactin dosages can be performed. Attention! For the diagnosis of premature ejaculation, it must happen within approximately 1 minute after penetration and before the individual desires it. Moreover, symptoms must persist for at least 6 months. At this point, a clarification is important. There are other conditions that can cause rapid ejaculation, such as erectile dysfunction, because if you have difficulty getting or maintaining an erection, The man feels anxious to ejaculate before the erection is lost. Anorgasmia, that is the difficulty in reaching orgasm, which also causes anxiety in men. Overactivity of the adrenal glands, resulting in excessive production of adrenal hormones, hyperthyroidism. Finally, some blood pressure medications and anti-anxiety medications. Now the time has come to know how we can cure this delicate disease. Permanent premature ejaculation has no definitive cure, but behavioral maneuvers combined with drug therapies are often successful. Behavioral therapy is a common form of treatment for premature ejaculation. He teaches us ejaculation delay techniques to help him better control his ejaculation. The most common are: squeeze technique. We squeeze the glands, example the upper part of the penis or the pelvic floor muscle just before ejaculation to stop or delay ejaculation. Stop-start technique. We stop sexual activity as soon as we feel that ejaculation is about to take place, and we resume only when the arousal decreases. We perform a masturbation before the sexual act with the partner to decrease the sensitivity of the penis. Kegel exercises, in order to create a more effective physical barrier to the leakage of sperm. These techniques can be taught by a sexual health professional and require time and commitment on the part of the patient to achieve and maintain long-term progress. A very useful therapy to treat premature ejaculation is couples therapy, as this condition can have a significant impact on relationships and the quality of sexual life. Couples therapy can help you talk openly and honestly about your problem and your needs and concerns, resolve any relationship issues that may be contributing to premature ejaculation, and develop greater mutual understanding and support in addressing the issue, develop new techniques and strategies for sex to increase sexual satisfaction and improve quality of life. Another common option for treatment is drug therapy. The most commonly used drugs are paroxetine, fluoxetine, sertraline, duloxetine. They help delay ejaculation by increasing serotonin levels in the brain. However, these drugs can cause side effects such as nausea, headaches, anxiety and erectile dysfunction. Your doctor may prescribe a drug on an ongoing basis, but may also recommend using it only before sexual activity, as they often have no ongoing effect. In addition, it is important that the patient and partner are informed of possible drug interactions and side effects. There are also some supplements that are promoted as a treatment for premature ejaculation, but their effectiveness has not been scientifically proven. Although premature ejaculation does not endanger the individual's health, it is a disorder that can lead to severe discomfort, undermining the patient's self-esteem. Very often, due to the resulting couple difficulties, it can also lead to an aggravated depression. We have now reached the end of today's video. We hope you enjoyed it. If you found it useful, support us with a nice like, subscribe to the channel and click on the bell to be notified every time a new video comes out. See you soon on Med for Care.